Well, good morning, ladies and gentlemen. My name is David Bell and I'm the Vice-Chancellor here at the University of Reading. It's a great pleasure to have you with us today on our beautiful White Knights campus. For those of you who haven't been before, a most special welcome. We've got a busy and packed programme, but if the weather stays like it is, I do hope you'll have the opportunity to spill outside and enjoy the autumnal colours. It is so good of you to join us at this very special Improving Mental Health in Schools conference. And it's great to see so many people, teachers, researchers, practitioners, other interested friends and colleagues who have this great commitment to improve children and young people's mental health and well-being. Now, the facts, as we know, are stark and concerning. Mental health difficulties are now much more common in young people than was the case previously, or at least as far as we know in terms of the reported mental health difficulties. Figures suggest that up to 10% of 5 to 15-year-old pupils experience mental health problems, and 3/4 of adult mental health problems have started by the age of 18. Although there are clinically proven and cost-effective treatments, only a minority of young people receive appropriate professional help. And we know from regular and at times heartbreaking reports in the local and national media that young people are frequently not eligible for mental health services or have to wait a terribly long time for treatment. And of course, for young people not to get the help that they need at an appropriate moment can have a damaging effect, yes, of course, on education, but also on life prospects much more generally. Now, of course, there is great recognition of the crucial role that schools and teachers can play in concert with other professionals and services. That's partly about identification of potential difficulties. It's also about identifying and intervening, and of course, helping to prevent the development of mental health issues where we can. And of course, the activities of teachers can be from improving well-being and resilience to offering appropriate training and development, and I think crucially important, helping to remove the stigma that sometimes still sadly surrounds those experiencing mental health difficulties. Now, of course, for those of you who are teachers in the room, you already have many expectations loaded upon your shoulders. And I always think that that's a two-edged issue. It demonstrates, doesn't it, that society places huge value on the role of teachers and the practical interventions that they can assist with and help to improve the life chances of their pupils. At the same time, there are, as I suggested, many expectations that you already have to manage. So part, I'm sure, of what we are wanting to do here and what we do more generally at the university is to provide teachers, support staff and others working in schools with the opportunities to learn more and to have great assistance when it comes to what they have to do. We also recognise that because of the pressures of time and all the other things that teachers have to manage, it's not always straightforward to know what to do. I think the other big issue that faces those working in schools and those working in any setting with children and young people with mental health difficulties is that they have to negotiate their way through a vast number of different programmes and interventions that are on offer. And of course, with that goes the need to identify what is evidence-based. And I'd imagine everyone in this room knows that not every purported intervention is evidence-based. And it's what's evidence-based and also what has been shown to be effective. And all of that is particularly important, first and foremost, to ensure that children and young people get the right assistance, but also it's really important given the inevitable financial pressures that face schools in determining how to spend their budgets. So against that backdrop, it's one of the reasons why this conference has come about. Here at the University of Reading, we have the Anxiety and Depression in Young People, more simply, ANDI Research Unit, led by Professor Cathy Cresswell and Professor Shirley Reynolds, which also includes a very busy research clinic led by Dr. Polly Waite. And the main focus of ANDI's research programme is to improve our understanding of anxiety and depression in young people and to prevent the development of common mental health problems, as well as identifying and offering access to the best evidence-based treatments and interventions. And the ANDI Clinic works in collaboration with the Charlie Waller Institute here at the University of Reading to train professionals to deliver evidence-based treatments. Now, perhaps unsurprisingly, given the context that I described, in recent years, ANDI has worked more and more with schools and become increasingly aware of the need for schools to receive guidance and advice around what approaches are evidence-based. In other words, what does and what doesn't work. And this conference, therefore, has been organised by ANDI along with young people and their families who have lived experience of having mental health difficulties. We're also working with two partner organisations, the Charlie Waller Memorial Trust and the Children and Young People's Mental Health Coalition. The Charlie Waller Memorial Trust was set up in memory of Charlie Waller, a young man who took his own life, and it aims to raise awareness of mental health among young people. It provides talks, training resources to schools, young people and professionals, as well as supporting the research and teaching in evidence-based therapies. The Children and Young People's Mental Health Coalition is a collaboration of leading organisations from across England which campaign on issues around mental health in children and young people. And it is also assisting in the provision of early intervention as well as influencing national policy and encouraging local commissioners to invest appropriately in services. We're very grateful for that support and that collaboration, and it feels to me that it illustrates a crucial point, that the most effective support for children and young people is often done through a partnership approach, and I'm sure you're going to hear much about that today. So I believe this conference offers a wonderful opportunity for researchers, teachers, others working in schools, commissioners in the National Health Service, private bodies, policymakers and young people themselves to start a dialogue, to continue a dialogue and consider what needs we are trying to address what works, and of course, what is practical and effective to deliver and commission. We're in a period, ladies and gentlemen, in which more and more publicity is being given to mental health difficulties. Many people, many prominent people are out there making the case for the best interventions. But of course, whilst that external championing is hugely important, in the end, the activities of people in this room and beyond are what will make a real difference to enable all young people to reach their full potential in life. I'm now going to hand over to Polly Waite and Laura Pass, the organisers of the conference, for them to tell you more about the day. Thank you very much.